Good morning friends, this is Dr. Nadagouda from Hubli, a consultant physician for the last 40 years in practice. Today I am going to apprise you about blood pressure and its relation to cholesterol. Every person in one family has a person having high blood pressure. What is the root cause for this? One of the root cause for this is high blood cholesterol. What is this cholesterol? Cholesterol is a bacterial substance which is produced by the liver in the body. Generally the required amount of cholesterol is produced, but if you go on taking cholesterol, 1/3 of it comes from the diet, and if this dietary cholesterol is more, then I think one gets the high cholesterol levels with all its complications. If this cholesterol is more, it is going to block the vessels, and if block the vessels, then I think what are called plaques, and if it blocks the vessels, if it is in the brain, it can cause brain attack. If it blocks the heart vessels, it is called as a heart attack, and if it blocks the kidneys, it can produce a kidney problem, and more so if it blocks the peripheral vessels, it can produce an ischemic limbs. So I think you have to take care of this cholesterol level. What are the different types of cholesterol? We have a bad cholesterol and we have a good cholesterol. The bad cholesterol is called as the TGLC, the LDLC, and the lipoprotein little a, which has to be reduced so that you can have a good vessel. The good cholesterol is the HDLC, which has to be increased so that it takes away the cholesterol which has been deposited. Bad cholesterol deposits the cholesterol, the good cholesterol takes away the cholesterol. So these as far as the cholesterol concerned. Where do you get this cholesterol? In the diet. In the diet we have what are called saturated fats and the unsaturated fats. The saturated fats are the non-vegetarian stuff like the meat and eggs. Then we have the dairy products also, which are the vegetable fats. The other vegetable fats are the one which are present in the rapeseed oil, the olive oil, and the sunflower oil. Now generally the vegetable fats are good, but even if they are taken in more accounts, then I think it can produce increase in weight. So you have to see that your cholesterol levels are normal whether you take a vegetable fat or a non-vegetarian fat. And number 2 is how do you control this? You can control this by your diet, by exercise, by stopping smoking, by stopping alcohol, by avoiding strain, and by regular exercise 30 minutes a day. Then having controlled your cholesterol, do you need to do anything else? Well, if your cholesterol is not controlled with all these lifestyle modifications, then I think you have to take medicines called as statins. Now with all these statins, if you are controlled, then I think you can go ahead and see that you do not have any complications in due course. Do I need to get my cholesterol checked? Yes. After the age of 20, you are supposed to get your cholesterol controlled, checked once in 2 years at least. And after the age of 40, if you are a diabetic, if you are hypertensive, then I think you have to get your control cholesterol checked every yearly so that you can keep it under control and lead a normal healthy life. Today I am going to appraise you of yoga in relation to high blood pressure. Everyone in the family or in each family we have a person who has a blood pressure, maybe a lady or a woman. Now, has this yoga got any relation to this blood pressure? This is the modern stressful life which we are going to have nowadays, which is the root cause for all these problems of heart attacks, high blood pressure, etc. So I think stress is one of the factors which is known to produce high blood pressure. How does stress affect the blood pressure? Stress, as you know, releases a lot of catecholamines, which is called as adrenaline, noradrenaline, etc. And these are the substances which can cause the narrowing of the blood vessels and raise the blood pressure. So by these stress mechanisms, if we can avoid it, I think it is best. To avoid the stress mechanisms, we have a lifestyle modification and we have drugs as well. Before we go to the drugs, we think of the lifestyle modifications, and among them comes the yoga practice. The yoga is a procedure where I think the body and the mind come into the picture. The body and the mind controls the body, and in this sense, I think yoga is very useful. What does yoga do? By yoga, you are concentrating on a certain part as far as the mind is concerned, and in some situations you will be exercising and doing what are called as yogasanas. Different varieties are there: sitting, standing, lying, walking, etc. So these yogasanas and this mind control will control the stress factor and tend to bring down the blood pressure. How should we practice yoga? I think generally it is to be taken from a guru. If you are don't have a guru, I think nowadays we have many TV programs which can give you what yoga is and what yogasanas are. And how does it control? By yoga, I think stress is controlled, so you can bring down the stress, and with yoga, I think the heart rate comes down. At the same time, the work of the heart also comes down, and as a result of which, I think the stress comes down, and the catecholamine release also comes down, as a result of which the heart rate also comes down. With all these changes in the yogic practice and practicing of yogasanas, I think you control your blood pressure, and this is along, this is not the only factor which can control the blood pressure. This is used as in conjunction with all the other medications, then only I think yoga will be useful. Yoga by itself may not be so useful in controlling the blood pressure and other factors, but along with lifestyle and if necessary with drugs, I think yoga can be a good exercise to control the blood pressure and so many other problems in our life and keep ourselves healthy. Thank you all.